Now, what MDMA does so uniquely is it switches off the amygdala fear response for a few hours. It really effectively, selectively turns off the amygdala. It's always psychotherapy that gets you through stuff.
Yeah.
Drugs are a stopgap to to bring down your temperature a little while you're waiting for the antibiotics to work.
Yeah.
And the psychotherapy of the antibiotics. Now, what's really important to understand here, Ben, is the exclusivity and the selectivity of MDMA. Now, there are many drugs that reduce fear response. A bottle of vodka reduces fear response brilliantly. Bag of heroin, fantastic, great at reducing fear response, which is why those two drugs are number one choice for people with trauma. You just don't want to feel fear. And who can blame them? I say this to my patients all the time. I can't judge or criticize you. If I'm in pain, I'm going to take a painkiller. And if I find that everything the doctor gives me doesn't hit the sides, I'm going to use heroin or alcohol because I know they work. We all want pain relief, but alcohol, heroin are messy, dirty drugs. You can't work on those drugs. What's so remarkable about MDMA as a molecule is it just so selectively turns off the pain, leaving the other faculties intact. So the patient can talk, debate, reflect, remember, bring up past memories, talk them through in clear consciousness with the therapist, but just the fear turned off. Just the fear turned off. But all the rest of it I can talk about. Now, you can't do that with alcohol or heroin because they'll just talk a load of rubbish. Yeah. And the crucial thing is they certainly won't remember the next day. And one thing I always ask my patients the next day after MDMA, I'll say, look, man, yesterday you spoke for 8 hours in great detail about this awful thing that you've not spoken about for 30 years. Were you just talking gobbledygook? Was it just rubbish? Were you just high? Do you even remember what we talked about? And they always say without fail, I remember every word of it. And not only do I remember every word of it, but it still stands now. I feel like I've done the work during those 8 hours yesterday, and I've resolved stuff, and I've seen things in a new way that I haven't been able to look at before because I've been in therapy for the last 30 years. And as soon as I even hear the word rape, I'm out the door. But you managed to turn off my fear for 8 hours, which allowed me to do the therapy I've been meaning to do for the last 30 years. And it stands. I don't have to be high again. I've done the work. The psychopharmacology community is split in a sort of 98% to 2 now. We fully recognize that in the vast majority of cases, MDMA is not a neurotoxic drug, certainly not at a clinical level. We have in the UK 25-year history, actually getting on 30-year history now, of massive heavy ecstasy use. 750,000 doses of MDMA are taken every weekend in the UK, every weekend for the last quarter of a century. And we are not seeing MDMA or ecstasy as a public health concern at all. It's not on the radar. And this is recreational ecstasy use. This is 10 tablets a night taken for months on end, together with vodka and heroin and cocaine and amphetamine and everything else. We're still not seeing ecstasy as a public health concern. It's not up there on the DEA list of stuff we need to tackle. It's just not. And we would have seen it by now had that been the case. Had it been as neurotoxic as we thought it might have been in the early 2000s, we would have seen it by now.